Dr. Hal Sessions, and I want to show you how the knee works and how the knee ligaments hold the knee together. And so I've come up with a really fancy knee here. It consists of this plastic bottle that is the end of your femur, your thigh bone, and then this is the lower part of your leg, which consists basically of your tibia, but also, of course, the fibula. But remember that the fibula does not participate in the knee joint. When we think about our knee, we want to think about what protections we really need, because basically a knee is just a bone at the bottom and a bone at the top, and yet they have to be able to survive pressures in all directions. And clearly, we don't want our knee to be able to go this way to the side or this way to the middle. And we also don't want our knee to be able to go this far too much, rip it off this way, and we certainly don't want our knee to go that way, to bend forward. That would not be a good deal. As you listen to the news and watch football games and sporting events, you hear them talking a lot about cruciate ligaments and all kinds of knee ligaments that are done to the knee. And that explains the other movement that's really important that we not let happen. And that is for the knee to go like this, boom, where the entire thigh gets pushed forward, or where we go like this, where the entire knee and the femur gets pushed backwards. So, I think one of the hard things in anatomy and physiology to understand is, well, what are these ligaments all about, and how do they work in order to give us a knee that is able to move in one direction and one direction only, which is like this, and yet not move in any of these other directions. You remember that a tendon is what connects a muscle to a bone, and a ligament is what attaches a bone to another bone. So, let's start by talking about the intracapsular ligaments. And these are ligaments that run through the knee joint itself. And let me just kind of illustrate those to you with two cruciate ligaments. Now, this is your anterior cruciate ligament, your ACL. And what you do to make your ACL work is your ACL is attached right here to the top of your tibia. Now, it's really more like there, but I kind of wrap it around in front for illustration purposes. And then your ACL comes through your joint right here and attaches back here to the back of your femur. Now, what that does is it prevents your knee from moving in this direction. Okay, and that's a good thing. And when you're a football player, if you're stupid enough to do that, you are going to get forces on the front of your thigh up here every time they tackle you, pretty much. That's going to be stretching your ACL backwards like that. So that's the ACL. And then we have this other beautiful PCL, posterior cruciate ligament. And it's basically attached up here to the front of the femur, and it crosses through the joint and comes back here and attaches to the back of the tibia, like that. So now you've got an ACL that's preventing the leg from going back like that, and you've got a PCL, which is going to prevent it from going forward too much. Now you may wonder, why do they call it the cruciate ligaments? What a silly name. Well, look from the side, like that, and you see that they make a cross. And cross is translated into cruciate in one of those old dead men's languages. I don't know, Greek or Roman or something. So those are the cruciate ligaments. They make a cross, and you can see what they do is they prevent the thigh up here from moving forward and backwards. When those get ripped, it's a big deal because you just lose all of that support. All right, so that's your A to P strength using your cruciate ligaments. I'm going to loosen this one up. This guy needs to relax his cruciate ligament a little bit. There we go. Okay. Now, remember that this is the medial surface over here, and it's got the tibia on it. And when you plant your foot in the ground as a football player, when you plant your foot and your spikes are into the turf, and somebody comes along and hits you from this side, some 330-pound tackle going at 4.3 speed hits you there, he's gonna bend your knee this way, and he's gonna rip the ligaments on this side over here, clearly, if he hits you hard enough. And so to prevent that to some degree, we have a ligament on that side, and we're going to call it the medial collateral ligament. The medial collateral ligament, because it's on the medial side of our knee. We also have another name for that ligament, and we call it the tibial collateral ligament. So tibial collateral ligament is going to be on that side, and you can probably guess that the fibular collateral ligament, or the lateral collateral ligament, is going to be on this side. So let's put it over here. Okay? And between those two ligaments on both the medial and the lateral side, the tibial and the patellar side of your knee, that should keep you from falling off to the side. And sure enough, it holds our knee here in pretty stable position. Now, you have a really big ligament up front to keep your knee intact, and it runs down here, and it attaches right down here into what the tibial tuberosity, that bump on the top of your tibia right there. And this one is called the patellar ligament. Now remember, the patella is the sesamoid bone, and the patella, the kneecap bone, is part of the tendon of the quadriceps muscle. The quadriceps muscle are the big muscles up here on the front part of your thigh. And so they come down through here, they enclose the patella in the patellar ligament, and then they attach down there. Well, that's a tendon, but yet it grants a great deal of stability to the front of your knee there as well. So it's a very important source of support for your knee. Now, just because you've got the front of your knee and the two sides of your knee and the front and back directions under control, you also want to have some support on the back of your knee back here. And indeed, in the back of the knee, and remember we call the back of the knee the popliteal space, we have two popliteal ligaments. And they sit here on the back of your knee, and they kind of make a cross also, but we don't call them cruciate ligaments. But they're the popliteal ligaments. Go like this, and they go like this. Okay? So, those are the 7 ligaments of your knee. The anterior and posterior cruciate ligaments are in bright orange here. They're the ones that actually pass through the joint itself. They're just right through the middle of your knee joint. The ACL and the PCL. Then you have the patellar ligament, which really is part of the patellar tendon here. That includes the patella and the quadriceps muscle and insertion here into the tibial tubercle. On the lateral side, you have the lateral collateral ligament, also called the fibular collateral ligament. On the medial side over here, you have the medial collateral ligament, also called the tibial collateral ligament. And then in the back of your knee, you have 2 crossing popliteal ligaments that support the back of your knee. Okay, now based on that, if all those ligaments were as tight as they could be, you couldn't move your knee at all, but we can, and that's an amazing thing. Now just a quickie to look here on this more lifelike model than my bottles and glasses here. This is a right knee also. This is the tibia. This is the fibula. This is the femur up here. So, coming off the quads up here, the quadriceps muscle, there's 4 parts to it here. They come through and become the patellar tendon. They surround the patella right there and insert, as I said earlier, into the tibial tubercle. On the lateral side out here, this ligament here is the lateral collateral ligament, also called the fibular collateral ligament. Over on the medial side, on the other side, which has the tibia on it, we call this the tibial collateral ligament, also called the medial collateral ligament. And then in back, we have two popliteal ligaments that are illustrated by these guys here. One goes this way, one goes this way, and those are the two popliteal ligaments. Now, the cruciate ligaments in this model are seen here and here. And we can oftentimes, if I can pop this guy off, I guess I can't. The cruciate ligaments are right here, and you can see that they actually go right through the knee joint. And they're very important. These on the sides can usually be, if somebody tears them, they can usually be kind of sewn back together. But the cruciate ligaments, when they are ripped, they require complete replacement and finding a piece of tendon elsewhere in your body and recreating a new ACL or PCL. Because of that, most football players, when they tear their ACL, they are out for a year flat. I think Adrian Peterson, who plays for the Minnesota Vikings, he came back in about 9 months, and that's an all-time record. And then he had a really good year based on that. But he rehabbed incredibly hard for that year in order to make that happen. So ACL and PCL inside are very tough to fix and very tough to recover from. So that's your knee, and so the next time you watch Monday Night Football, you'll know exactly what they're talking about when somebody tears the ligaments in their leg. Thank you.